Hey everyone, and welcome to the Dissenter Weekly. I'm Kevin Gosztola. I'm the managing editor for Shadowproof.com. The quarantine continues for so many people throughout the world, and in the cycle of death and economic devastation, we are still in the upward part of the curve. But before we get on to some of these important stories, these whistleblower stories that we have to cover for the week, Brian has some housekeeping items for you.
Yes, thank you, Kevin. I just wanted to ask people, if you enjoy this show, please subscribe to it on YouTube. Please like us on Facebook, follow us on Twitter. We want you to keep up to date with us and everything that we're doing right now. And just a reminder that we are 100% reader supported. We know it's a very hard time for many of you out there, but if you are in a position to donate, please go to shadowproof.com/donate and check out our options there. And if you're not, consider telling us just about your friends and family and sharing our stuff on social media. We'd be very appreciative of that. Kevin, let's go to our first story here about the U.S. government deregulating massive amounts of nuclear waste. Does not sound very good. What's going on in this story?
Well, this is horrifying. And one of the aspects or I guess sort of stories that I'm watching out for during this pandemic are the kinds of stories like this, where you see President Donald Trump's administration taking advantage of the pandemic to push forward with something that they normally couldn't get away with if there wasn't a global pandemic happening, if there weren't crises happening throughout the entire United States. And so this U.S. government agency that is tasked with regulating nuclear energy, they're called the Nuclear Regulatory Commission, the NRC, is using the cover of this pandemic to massively deregulate the disposal of nuclear waste. That's according to Public Employees for Environmental Responsibility, or PEER. This is a group that is known for its work representing environmental whistleblowers in government agencies. And they say that NRC is pushing forward with a plan to allow, quote, every reactor in the country to dump virtually all its radioactive waste except spent fuel in local regular garbage dumps, which are designed for household trash, not for plutonium. You heard that correctly. I'm not just like making up some stupid story here. Every reactor in the country would be able to dump virtually all the radioactive waste except spent fuel in local regular garbage dumps, is what they're warning. The proposal would allow for waste with doses of nuclear energy equivalent to more than 900 chest x-rays over a lifetime, which means that the cancer risk would be 3 times higher than the upper end of what the EPA considers acceptable. And this is another quote from their press release. Both the National Academy of Sciences and EPA calculate that the risk of such doses would be every 500th person getting cancer or being exposed to getting cancer from the radiation. And it gets worse if you think that's possible. It gets worse because the public may not even know where this radioactive waste is being dumped, because in the way that they're approaching this proposal, they're going to roll back the requirements for public notice and open hearings. So that would mean that they get to do this in total secrecy. And the only way we would know is if employees in groups like PEER speak up, or other individual whistleblowers at these working on nuclear waste, working to manage nuclear waste, would speak out. So this is highly, highly terrifying, and definitely something that needs much, much more attention.
Wow, that is a very horrifying story, Kevin. Thank you for bringing that to us. It boggles my mind to think about all of the horrendous things like this that are going to go under the radar with the coronavirus pandemic going on. So definitely appreciate you bringing this story to light. And speaking of horrifying news, we have another story here involving an EPA whistleblower who suggests the CDC and the FDA are wrong to downplay COVID-19 risks in food. What's going on here?
Well, first, I want to just say that this isn't being done in some official capacity. I think she has been retired from the EPA for some time, and this is her opinion as a chemist. But in her opinion, this is Kate Jenkins. She's an EPA whistleblower who believes that both the Centers for Disease Control and Prevention and the Food and Drug Administration are downplaying the risks that could be posed through food consumption. And they're suggesting that there's just no evidence that you could get COVID-19 by eating food. And yet, according to her, she believes that this is maybe premature, that there's some more work and study that should be done because there actually is some evidence out there to the contrary. Now, so I can establish that this isn't just crank science, Jenkins is known for criticizing the EPA when it was assuring people after the September 11th attacks that the air quality was acceptable, even though the World Trade Center. She's also known for criticizing the EPA's the use of Agent Orange in Vietnam, the way it handled the use of Agent Orange. So this story, and by the way, it comes from Environment and Energy's news website, which is a site that focuses on environmental and energy policy. It seems to have a focus on news that is important to these industry professionals. And so EPA's, this former EPA scientist, Kate Jenkins, blasted out an email last week. This is from the E&E story that questioned whether the coronavirus can be transmitted orally through food and whether the Centers for Disease Control, Prevention, and Food and Drug Administration had failed to convey the potential risk to the public. This is her quote: "There's no reason to believe that food is safe and cannot transmit viruses, as the CDC and FDA are claiming. There is no way there can ever be proof except with animal studies, and they would be too late." So she pointed to recent studies of cases in China that found that many patients had in fact presented respiratory symptoms, but at the same time, there was a subset that had experienced digestive issues like diarrhea. And there's a study that was done in an American Journal of Gastroenterology that analyzed more than 200 patients, and it found that in many cases, diarrhea was present as a symptom before respiratory issues. So it suggests that the disease may be more severe, causing a higher mortality rate in those with digestive symptoms. So it's something that we haven't seen in the regular coverage of the virus thus far. It points to the gaps that we have in our understanding of something that is novel and new. It isn't necessarily to say that there's a cover-up here about the virus, but it's to say that there's so much more to learn, and we're all trying to play catch-up because the crises are so severe.
Thank you, Kevin. I think that's a good way to contextualize it as well. So I really appreciate that. Our next story here is out of Arizona. I believe this story is by a friend of mine, Jimmy Jenkins, a really excellent reporter out of Arizona, and I encourage people to follow him. We are learning that Arizona prison whistleblowers have claimed that staff are forbidden from wearing masks. What's happening here?
Yeah, this got a lot of coverage, and I think just fit mentioning on our show that there's a lieutenant that has now filed an official whistleblower complaint and says that the director of the Department of Corrections, whose name is David Shin, is prohibiting staff from wearing masks or other protective equipment in the state prisons. The complaint submitted suggests that Shin believes the masks would scare the inmates. And according to the complaint, it says, quote, "The reasoning is ridiculous, and Director Shin's decision is putting the health of the staff, inmates, and the general public at increased risk." Now, one thing to note is that Arizona is not one of the states. There's only a few states really, but it's not a state that has taken decisive action to release prisoners. So that's one thing to keep in mind as we're talking about what officials could do to protect people. But then the very minimal thing of having individuals wear protective gear is something that they're avoiding. And this isn't unique to prisons. In fact, I know that places like Walgreens are prohibiting staff from wearing the masks because they too believe it will scare people, would scare customers. So you have corporations, you have government agencies who are more hung up on public relations and appearance and perception than actually having safety in the workplace. And this is the result. And so we could just imagine that, and this isn't just because there's a shortage. It's I think we've actually heard this in hospitals too. People really believe that putting on these masks is going to frighten people, even though we all should know by now that this is a step that can be taken to minimize the spread.
Thank you, Kevin. And if I might just add, personally, I don't think that the fear is necessarily coming from people seeing others wearing masks. It's from knowing largely that in this society, everyone's left to their own devices. We can't get good information. Our healthcare system is in shambles. I know I personally would feel better if everyone was wearing masks, but suffice to say, I'm glad you brought that story to our attention. Oh, go ahead.
Well, and I wanted to just add that we heard conversation about how will the CDC advise everyone to wear a mask? Right. And that would be a great policy, perhaps. But how are we going to get these masks? So, the fact that someone has a mask, even though they're scarce, but then is told that they can't wear those masks, that just is unfathomable to me. Right. I mean, when it's so hard to come by, why would you possess a mask, but then not wear it around when you want to use it and use it for something so innocent? And I think the answer is, and the answer is, if you're wearing a mask in a prison, we'll keep it focused on this particular story. If you're wearing it in a prison, then people might ask, what about the risk to inmates in this facility? Well, we're just going to have staff walk around with masks, but does that guarantee that inmates aren't going to get the virus? And why aren't you releasing people who are eligible for parole? Why aren't you releasing people who are towards the end of their sentences? Or why aren't you releasing these elderly people, compassionate release? Why don't you come up with all these different categories of people who no longer need to be at this risk? Why don't you temporarily release people and then call them back to the facility when this outbreak is over, like some other jurisdictions around the world have done? And they just don't want to do that. So they would rather keep up this appearance that the outbreak really isn't something they need to be concerned about in these facilities in Arizona.
Right. Thank you for that. Let's move along here. Our next story. We've seen a couple of these in the last couple of days. Medical staffing company cuts salaries and benefits for hospital staff fighting coronavirus. What is this story?
This story comes from ProPublica, and if I could really say, I think they're doing tremendous work during the coronavirus pandemic. It's definitely one of the outlets that I think deserves your support. If there are reasons to unsubscribe from the New York Times, there are reasons to support the work of investigative journalists at ProPublica and other outlets like The Appeal is another place that I think has been doing some phenomenal work throughout this pandemic. And so they report at ProPublica that Altion Health, which is backed by the private equity firms Frazier Healthcare Partners and New Mountain Capital, that they're going to be cutting salaries, time off, and retirement benefits for doctors and nurses during the pandemic. And in the report, they quote a Altion clinician who spoke anonymously. So this is a bit of whistleblowing, in my opinion, saying it's completely demoralizing. At this time of all times, we're putting ourselves at risk, but also putting our families at risk. And why is this happening? Why are we seeing this happen? The report says that staffing companies are losing revenue as hospitals postpone elective procedures and non-coronavirus patients are avoiding emergency rooms. There are health insurers that are processing claims more slowly as they adapt to a remote workforce. And these are all pressures that exist because we have a for-profit healthcare system. It's rather simple. The reason why we are doing this to nurses and doctors during this time when we should be supporting them, the reason why they are going to be feeling more economic hardship in addition to the psychological distress that they are undergoing, it's because we don't have a public healthcare system like a single-payer healthcare system, or we have not expanded Medicare to cover all Americans. So ProPublica can do numerous stories about the corruption within our private healthcare industry and what we're all being subjected to during this outbreak. The reason why this corruption is so severe is because we just do not have an infrastructure that can support all of these hospitals. And so they have to make these cutbacks that go after and really upset and I think undermine the integrity of what is being done by all of these doctors and nurses. I mean, certainly if you're going into the hospital on a daily basis to deal with the surging number of deaths, and you believe that you're going to be a poor person and you're not going to be able to pay your bills, and you're dealing with that kind of anxiety, how can we expect these people to keep up this work? I think you see people quitting, you'll see people abandoning this commitment. You'll definitely see others in the industry or people who are outside the industry who maybe want to become nurses and doctors. They might look at what's happening and decide that they no longer want to pursue this career because it's just so clear that you're going to be having difficulty paying your bills. So I think the story is really important because it shows why we have to have a Medicare for all system.
Yeah, and I think it also calls absolute bullshit on Joe Biden's claims over the last few days that this has nothing to do with single-payer healthcare. This is a perfect example of how these issues intersect with each other. So,
right, because the government could just invest in these hospitals and manage all of these issues if they were the single payer.
Right. Let's go to our next story here. Whistleblower exposes alleged Saudi phone spying campaign in the United States. What do we have here?
Yeah, so this story comes from The Guardian, and I'm just going to pull a few details from it, which is essentially that a whistleblower, an unnamed whistleblower, came to them with some data that suggests that this global messaging system called SS7 appears to be involved in a systematic spying campaign by the Kingdom of Saudi Arabia, and they've had experts that looked over how it works. And the basic essence is that Saudi Arabia would be tracking people, dissidents particularly, but anyone else that they thought was possibly going to challenge the internal circle within the Saudi Arabian kingdom. Then when they travel to the United States, they're doing the kind of location tracking that we've all learned about thanks to Edward Snowden and the NSA whistleblower disclosures. Although this seems a little bit more newer, specifically speaking, the global messaging system that's being described here isn't technically one that was exposed by Edward Snowden, but the nature of it is what I'm saying is that this kind of mobile tracking by that is enabled to go after subscribers is something that the Saudi Arabian kingdom is exploiting. And we don't really know what this is for particularly. We don't really know how much the U.S. government knows that this is actually ongoing, whether they're complicit and are all right with having Saudi Arabia track these people, it seems. But we do know that Mohammed bin Salman has been doing this kind of surveillance. I have no sympathy or care for Amazon billionaire Jeff Bezos, but it's mentioned in this article that he, in fact, had his mobile phone hacked in 2018 after he had been exchanging messages with Prince Mohammed. So it's just a fact that people, whether they are elites or not, are being targeted by the Saudi Arabian kingdom. And this is something that I think should concern people, but I also am aware of the context, the global context here, the fact that the United States government likely engages in this kind of mobile location tracking through its agencies. And so, if Saudi Arabia is doing this, it's probably because there are other countries that are engaged in this as well. So this just reveals another aspect of the global mass surveillance system that we have that is being set up, where you have powerful countries that are capable of tracking their citizens all over the world.
Thank you, Kevin. That's a great story. I'm really glad you brought that to our attention. We have one more story here. This involves Belmarsh prison, where Julian Assange is being held in the United Kingdom. There's a report here that the prison has a history of inadequate infection control. Obviously, with Julian's own health problems, this is even more concerning. But can you tell us a little bit about this report?
And I wanted to highlight this because it comes from a newer project called Declassified UK. A couple of journalists started it. Matt Kennard and Mark Curtis are involved in this. This is a project that is designed to focus on exposing the intelligence agencies, to focus on the security state, you could call it that, in the UK. They've done some pretty good journalism exposing conflicts of interest for the judges that are involved in reviewing Julian Assange's or overseeing the extradition process against Julian Assange. And so this is a story that was posted about Belmarsh prison, and they looked into earlier reports that flagged the prison as a place that was failing to adequately prevent the spread of infections in the facility, particularly in dental facilities. This goes all the way back to 2005. There was a 2007 report that pointed out that infection control was inadequate, again, in a dental suite in 2009. This was still a problem. Decontamination standards were not good. And a lot of this seems to relate to dental surgery. So we don't know what extent dental surgery might be continuing during this outbreak. But again, it's just tracking all the way up through 2018. They still were having problems until it was finally noted that they were starting to implement the measures that needed to be put in place for infection control and communicable disease prevention, for preventing the spread of these diseases. So we really don't. Julian Assange is in this facility, and that at least 100 staff, maybe more, have stayed at home. They quarantined as a precaution because it was known that at least a few people in Belmarsh had the virus. We don't really know what kind of testing has been done for inmates, but we do know that there are people being tested in British prisons widely throughout the country that have tested positive. It's mentioned in this article that 27 inmates throughout 14 British prisons have had the virus. So we know, just like any other place in the world, that these prisons are petri dishes where people could get this disease. And so this is just has intensified the calls to release Julian Assange, who is, again, in there. He's charged with crimes. He's not been convicted. We don't know when we're going to have the extradition hearing. It's likely delayed. We're talking right now, and it's in the next week or so, it will be the year anniversary of when he was expelled from the Ecuador embassy. And it's all very serious because we know his condition going into Belmarsh had deteriorated significantly. That the doctors were terribly concerned about his medical condition, and so he's terribly vulnerable. He's one of those prisoners inside of he's one of the detainees inside of this facility who is extremely vulnerable to this virus. Everyone's vulnerable, of course. Everyone can get the coronavirus, but Julian Assange is more vulnerable because of the chronic lung condition that his attorneys mentioned, and also because he has gone through medical treatment within the facilities. Presumably, he might have still been receiving care while he has been there in the last few months. He's probably received some kind of treatment, so been in and out of these these medical facilities. And so it's something to just be very concerned about here, that he is still in jail. He served his sentence for, quote unquote, jumping bail or skipping bail. After serving that sentence, he easily could have been put on house arrest and tagged electronically and been kept under close watch and supervision while he went through the hearings for the extradition and found out if he was going to be extradited or not. It was something that the judge has not permitted to be an option for how to manage Julian Assange's case.
Thank you, Kevin. I really appreciate that. And, people who are incarcerated, whether it's in this country or in the UK, are disproportionately sick. I think the thing about Julian isn't that his case, makes him any more important than anyone else locked up in these facilities, but that he, in many ways, is a visible example of what a lot of people in his situation are going through. So I'm glad that you highlighted that.
And to that point, and to the credit of the campaigners with Don't Extradite Assange, who are some of the loudest advocates for Julian Assange to be released, if you look at their messages on social media and the way that they're advocating for him, they are saying release prisoners from British jails along with Julian Assange. They're including other prisoners in their call for release because they know that this isn't just about one single person. Mm-hmm. What can impact Julian Assange is also going to impact the entire population in Belmarsh and these other facilities. So the call is to all British officials to do something more to protect these human beings. I want to close by saying a few things about where we are at in this crisis. Last week, I spoke about where we can expect to see more whistleblower stories and what we need to be watching for in terms of the corruption around this crisis. What I'd say is you have the potential for false claims to be filed, allegations of fraud to be brought forward against any of these private companies or officials and agencies or people who are involved that are getting this money for coronavirus aid. I think there is a lot of grift that is probably unfolding, and we're going to learn these stories later on. 6 months to a year from now, they'll start to come out. Maybe it'll take longer, who knows? But those are going to be important stories to tell, and I think whistleblowers are going to be at the center. You can expect to hear some whistleblower disclosures around this $500 billion slush fund that was passed in the third coronavirus relief package. It was I don't even know if it's fair to call it a bailout. It was a massive transfer of wealth to the tune of multiple trillions of dollars to these corporations to use essentially however they please. There were some restrictions over the next 5 to 6 months. And especially during this outbreak, but you're going to see a lot of latitude for airlines and other industries to use this money and then at the same time lay off workers and respond to the crisis and through downsizing essentially and get away with that kind of a thing. Hospitals, people are going to need to continue to look out for nurses and doctors who come forward and speak about the conditions as they're responding to the surges in deaths. I think that you're going to want to keep track of these stories in prisons. Inmates and detainees inside are whistleblowers, but I also think that we should listen to the prison staff as well, even though they are part of maintaining the mass incarceration system. They know that they're going to have their lives at risk because these states aren't taking certain steps to protect them. And if you're not protecting the staff, you're not protecting the inmates. And so you're not protecting people in these facilities. And in the effort to maintain mass incarceration, I think we're going to find some really important whistleblower stories will come out about what happened, the way a majority of the states are choosing to keep people caged instead of releasing them during this crisis. And I think we're going to need to, as we started this show, be on the lookout for these stories where you see government agencies moving forward with unpopular policies, taking advantage of this crisis, doing what Naomi Klein would call the disaster capitalism or the shock doctrine, where they know that we have a very limited amount of attention and it's all focused on the coronavirus outbreak. And there are certain things that they can do in the shadows right now that we're not going to notice, or they're hoping we don't notice. And so it's up to us to listen to any whistleblowers who come forward and try to pump the brakes on these initiatives because they're going to be initiatives like the one we're talking about with deregulating nuclear waste that could result in tons of people getting cancer. And again, in a country that has a for-profit healthcare system where, you know, if you get cancer, you're probably going to run up hundreds of thousands of dollars in medical bills. And you're likely to die from it too in the end, because there's just no cure for cancer. So the reality is that you would go bankrupt, and then your family member or relative would die, and it would come from something that was preventable. And a lot of these deaths that we're talking about are preventable. So I close just with you wanting you to look out for these whistleblowers when they're coming forward. Whenever you see in news stories that somebody is speaking anonymously because they fear retaliation, especially if they're not in a position of power or authority, you should take what they're saying seriously, because I think they are doing it at great risk to themselves. They could come under economic hardship during this time, because we're seeing so many people file for unemployment. And the fact that people would still speak out rather than just go with the current is important. It's something that I think we need to recognize. And so share what you're hearing from these people. If you're reading local news or you're reading national news and you see these people who are speaking out at great risk to themselves. And I think that brings us to, I just wanted to note that there was a story that happened. Bernie Sanders spoke out in support of this individual. There are a lot of people that spoke out in support of this individual, but Amazon fired Chris Smalls, who organized a walkout in protest of unsafe practices at Amazon during this pandemic. And this is a story we covered on last week's Dissenter Weekly. And I just wanted to mention that there are groups that are pushing for him to be reinstated, and that there are groups that are basically calling this out for what it is, which is the Amazon company taking advantage crisis in order to get rid of somebody who was speaking out against them. And you have basically a spokesperson for Amazon saying that the reason why Chris Smalls was fired was because he had violated social distancing rules. So like that somehow makes it okay for this. They're clearly exploiting some of the CDC guidelines in order to go after someone who organized a protest and made the Amazon corporation look bad. And just to remind you that Jay Carney worked for Obama administration. That was a key proponent of escalating the war on whistleblowers. So we know where Jay Carney stands. We know that Jay Carney is an apologist for whistleblower retaliation, because he was that way when he worked in the Obama White House. And so I want to thank you all for watching. I think Brian will have some final thoughts, but to all of you Shadowproof members, people who are readers of our site, every one of you who continues to give to our website to make it possible for us to pay our bills, I'm hugely appreciative of you, and even more so in this time of crisis. And if you feel like you have to stop giving because you're coming under some economic stress, you need to come back to us later. We understand. We're just going to ask others who do have money, who do have income that's expendable, to step up and help us fill gaps, because we know that you don't have to be the only one. I mean, we have people who graciously give their Social Security checks, and that's always amazing. But if you need that money to live off, we understand, because this is a really intense crisis that we're going through right now. And there will be others who step up to support us, because our work is going to speak for itself. If people believe that we're doing something that needs to reach people, we're going to see people give. I have seen that through this crisis already. There's been people who've given hundreds of dollars to us just because they know that there's a value in us continuing our work. So I leave you with that, and I thank you for watching this show.
Very well said. Thank you, Kevin. Just want to say ditto to everything you just said. That was great. Yeah, if you have tips, going back to what Kevin was saying about if you see something in the local news, you can hit us up on social media, or you can send us an email at editor@shadowproof.com. Once again, thank you all so much. Subscribe to the show here on YouTube by clicking that subscribe button. Follow us on Facebook and Twitter. And again, if you're in a position to support us, even just a couple dollars a month, or even just a one-time, small donation, shadowproof.com/donate. And otherwise, if you just want to tell friends and family about us or share our articles and our work on social media, that also goes a long way too. So we're really appreciative of everyone out there. Please stay safe, and we will talk to you next week.